Scenario 6, Human Development, Real Scene 2, Health, Illness and Disease. Health is a state of complete physical, mental and social well-being, and does not consist only of absence of disease or infirmity. World Health Organization. My goal. After I complete Scenario 6, I'll be able to use adverbs of frequency and construct questions using the phrases how often, how well, and how long. I will also learn about gerunds and infinitives. The reading material will teach me about today's most important diseases and how to prevent them.
Introductory questions. Number 1. Why is it important to be healthy? Number 2. Have you had training in CPR? Number 3. What habits would you like to change in your life to be healthier?
Introduction. Defined negatively, health is the absence of illness. Defined functionally, it is the ability to participate in everyday activities, and defined positively, it is fitness and well-being. In any living organism, health is a form of homeostasis. This refers to a state of balance with inputs and outputs of energy and matter in equilibrium. Good health implies good prospects for continued survival. For humans, health is a broader concept and encompasses physical, mental and social well-being. According to the WHO definition of health, 70 to 95% of the people in the world would be classified as unhealthy. A deeper inquiry into the definition of health reveals that what makes a cell healthy is independent from that which makes an organism healthy. Similarly, what makes an organism healthy is independent from that which makes a population healthy. To illustrate this point, consider that Japan has the greatest life expectancy of any nation, despite having one of the highest smoking rates, especially among men. Aspects of health and wellness that fit within the realm of medicine are environmental health, human nutrition, disease prevention, and public health matters.
Listening. Conversation. Listen and practice with a partner.
You're really in shape, Bill. You look healthy.
Well, I always get up early to go jogging.
Really?
Sure, I sometimes play soccer too.
How often do you exercise?
About twice a week. How about you?
I seldom exercise. I usually stay home or visit friends.
Grammar Structure 1. Adverbs of frequency and expressions of time. Adverbs of frequency tell us how often somebody does something. They come before the main verb and answer the question, how often or how frequently. Always is 100%. Never is 0. In between are usually, often, sometimes, hardly ever, and seldom. For example, do you ever go to the gym? Yes, I usually go in the evening. I sometimes go on the weekends. I seldom exercise. No, I never go to the gym.
Expressions of time clarify the time that the sentence subject refers to. They are typically placed at the beginning or the end of the sentence. E.g., I shower every day. Once I went to that pub. I am working at the moment. On Saturdays, I hang out with friends. I haven't finished my homework yet. When I arrive, I ate. By next June, I will go to Canada.
Writing. Exercise 1. Insert the adverb in the following conversation in the correct place. Do you go to the gym? Ever.
Yes, I do aerobics. Twice a week.
What do you do on Sundays? Usually.
Well, I sleep until late. Always.
Do you go out at night? Often.
Not very often. About once a month.
Related topics. Disease. A disease is any abnormal condition of the body or mind that causes discomfort, dysfunction, or distress to the person affected or those in contact with the person. The term diseased is used broadly to include injuries, disabilities, syndromes, symptoms, deviant behaviors, and atypical variations of structure and function. Pathology is the study of diseases. The systematic classification of diseases is referred to as nosology. The broader body of knowledge about diseases and their treatments generally referred to as medicine. Syndromes, illness, and disease. Medical science distinguishes a disease which has a known cause or causes called an etiology from a syndrome, which is a collection of signs or symptoms that occur together. Many diseases and their causes have been identified, yet continue to be referred to as syndromes. Furthermore, numerous conditions of unknown etiology are mistakenly referred to as diseases. The term illness, often used to refer to disease, can also include a person's perception of their health and does not necessarily mean they have an actual disease. A person without any disease may feel unhealthy and believe he has an illness. Another person may feel healthy and believe he does not have an illness, even though he may have a disease such as dangerously high blood pressure, which may lead to a fatal heart attack or a stroke. Transmission of disease. Some diseases, such as influenza, are contagious or infectious and can be transmitted through a variety of mechanisms including droplets from coughs and sneezes, by bites from insects, or from contaminated water or food. Other diseases such as cancer or heart disease are not caused by infection, although microorganisms may play a role. Social significance of disease. The identification of a condition as a disease, rather than a variation of human structure or function, can have significant social or economic implications. The controversial recognition of diseases such as post-traumatic stress disorder or shell shock, repetitive motion injury or repetitive stress injury, and Gulf War syndrome has had a number of positive and negative effects on the financial and social responsibility of governments, corporations, and institutions in terms of the affected individuals, as well as on the individuals themselves. The social implication of viewing aging as a disease could be profound, though this classification is not widespread.
Group. Comprehension questions. What's the definition of disease? What is pathology? Find the meaning of the following words: nosology, etiology, and syndrome. What is a synonym for disease? What is a common way to transmit a disease? Grammar structure 2. Questions with how. How often do you monitor your health? Once a month? Twice a year? Not very often. How long do you spend at the fitness center? 2 hours a day? 8 hours a week? How good are you at following a diet? Pretty good. Not too bad. Not so good. Writing. Exercise 2. Complete the questions using how. At tennis? I think I'm good. I sometimes play at night. each day? Usually 3 meals a day. Exercise? I usually exercise 2 days a week. A physical exam? I get a health checkup once a year. Reading. Common diseases that affect your health.
Hypertension. Hypertension or high blood pressure is a medical condition where the blood pressure in the arteries is chronically high. While it is formally called arterial hypertension, the word hypertension alone usually refers to arterial hypertension. Persistent hypertension is one of the risk factors for strokes, heart attacks, heart failure, and arterial aneurysm, and is the leading cause of chronic renal failure. Definitions. The term blood pressure refers to the force exerted by circulating blood on the walls of blood vessels. The heart creates it as it pumps blood into the arteries and through the circulatory system, and by the arteries themselves as they resist the blood flow. An individual's blood pressure is variable. It fluctuates up and down over the course of a day and is influenced by many factors. The risk of various health problems rise along with one's blood pressure. Normal blood pressure is approximately 120/80 mmHg, and hypertension is only diagnosed after measurements greater than 120/80 are discovered in both arms on 3 occasions over the course of several weeks. Blood pressure over 120/80 mmHg and below 140/90 has been defined as prehypertension. Prehypertension is not technically a disease. It is a term chosen to identify individuals at high risk of developing hypertension. Etiology. Causes of hypertension: increasing age, high dietary salt intake, sedentary lifestyle, cigarette smoking, alcohol abuse, high levels of saturated fat in the diet, obesity, stress, low birth weight, diabetes mellitus, other genetic factors.
Hypertension. Hypertension is usually found incidentally by healthcare professionals. It normally produces no symptoms. Malignant hypertension or accelerated hypertension is the late or advanced phase of hypertension and may present with headaches, blurred vision, and organ damage. Hypertension is rarely severe enough to cause symptoms. This only surfaces with a systolic blood pressure over 240 millimeters of mercury and or a diastolic blood pressure over 120 millimeters of mercury.
Myocardial infraction. Acute myocardial infraction, AMI or MI, commonly known as a heart attack, is a serious sudden heart condition usually characterized by varying degrees of chest pain or discomfort, weakness, sweating, nausea, vomiting, arrhythmia, and occasional loss of consciousness. It occurs when a part of the heart muscle is injured. This part may die because of sudden total interruption of blood flow to the area. It is often a life-threatening medical emergency which demands both immediate attention and activation of the emergency medical services. The phrase heart attack is occasionally used to refer to heart problems other than myocardial infraction, such as unstable angina pectoris.
Diagnosis. Myocardial infarctions vary greatly in severity from a slight feeling of discomfort, similar to indigestion, to sudden death. Classical severe cases of myocardial infarction can be identified quickly by ambulance staff, emergency room doctors, and cardiac specialist nurse practitioners. For a complete diagnosis, the patient's medical history, combined with electrocardiogram's results and a blood test for heart muscle cell damage, are vital. Electrocardiograms, or ECGs, are a diagnostic tool used by physicians to measure the health of a heart. Measurements taken from the surface of the skin correspond to the electrical activity of the heart and the electrical sequence that controls the heart action. After a myocardial infarction, changes can often be seen on the ECG called Q waves, which represent scarred heart tissue. Cerebrovascular accident. A stroke or cerebrovascular accident, CVA, occurs when the blood supply to a part of the brain is suddenly interrupted. This can happen in two different ways: by an occlusion in the brain called an ischemic stroke, or by hemorrhage in the brain called a hemorrhagic stroke. Ischemic stroke. An ischemic stroke is death of an area of brain tissue caused by an inadequate supply of blood and oxygen to the brain due to a blockage of an artery that supplies the brain. Commonly, blockages are blood clots or pieces of fatty deposits due to atherosclerosis. Ischemic strokes account for about 87% of all strokes. Bleeding within the brain and/or bleeding between the inner and outer layer of the tissue covering the brain cause hemorrhagic strokes. This occurs when a weakened blood vessel within the brain ruptures and bleeds into the brain tissue, causing damage due to pressure. Hemorrhagic strokes. Hemorrhagic strokes account for only 13% of all strokes, but are more frequently deadly than ischemic strokes. Signs and symptoms. The symptoms of stroke are usually easy to spot: difficulty breathing, loss of ability to move, swallow, or speak, loss of consciousness, seizures, abnormal or lost sensation on one side of the body, sudden change in mental state or confusion, muscle weakness, problems with vision, dizziness, loss of balance or coordination.
Group writing questions for discussion. What is hypertension? What are the main causes of hypertension? What are the symptoms? How can you diagnose a myocardial infarction? What's an electrocardiogram? Do you know anyone who ever suffered a myocardial infarction? What did you do? What is a stroke? How do you identify a person experiencing a stroke?
Grammar Structure 3. Gerunds and infinitives. 1. A gerund is a verb in its ing form, used as a noun. For example, eating, going, seeing. Gerunds are used: A. As the subject of a sentence. Smoking is bad for you. B. After some verbs such as like, hate, enjoy, quit, suggest, dislike, deny. I like cooking. I enjoy fishing. C. After prepositions. I'm interested in buying a computer. I'm scared of walking alone in the dark.
Number 2. The infinitive form of the verb is the original verb. It can be with or without to. For example, eat or to eat. Go or to go. See or to see. The infinitive form is used: A. After some verbs such as agree, arrange, ask, promise, decide, afford. I agreed to do the work. I arranged to see the doctor. They decided to get married. B. To show the reason why you did something. Tony went to the post office to pay a bill. C. After adjectives. I was surprised to see Erica. I'm pleased to meet you.
3. A. Some verbs can be followed by a gerund or infinitive with no change in meaning. For example, start, begin, hate, like, prefer, continue. She started to cry. She started crying. I hate watching horror films. I hate to watch horror films. B. Some verbs can be followed by a gerund or an infinitive, but there is a change in meaning. For example, try, remember, stop. I tried to get into the house. I tried climbing through the window.
Research spot. Look for more information about Number 1. What to do in case of a heart attack. Number 2. CPR. Number 3. Most common diseases in your country. Number 4. Cures.